All right. Hello, everyone. This is Steve with HelloNote, and thank you all for joining in on our HelloNote 2025 innovations and roadmap. So thank you all for joining. First, hope you had a great Thanksgiving, everyone. And now we're approaching the holiday season again with all the holidays of Christmas, Hanukkah, everything that you celebrate. And we are extremely grateful for all of you. And not only because you may or may not be working with us, but also because we value your feedback. So HelloNote is a product of the community we serve. Okay, so the ones that have been with us from the beginning, you know that we always try to innovate, not be stale. So every one of our users, whether it's a therapist, administrator, biller, front desk, and even patients, have given us feedback throughout the years that we implemented HelloNote. So I do want to personally thank all of our internal team as well. So that includes the engineering team, support team, onboarding, web team, customer success team, sales and marketing, and our affiliate network. They're extremely important to us, and without them, HelloNote would not be possible at all. So also wanted to mention that we did mark a huge milestone. We did finally cross into fully 2.0. That means all of the users from 1.0 are now officially on 2.0. And just over a year ago, we actually had our HelloNote 2.0 launch party, and many of you were able to join us in New York City. So that was awesome. If you didn't join us, then we actually hope to have another event next year. So, and that was just the beginning. We are here today, a little bit over 1 year later, and there's so much that we have accomplished and so much more that we still want to accomplish. And we do want to share our roadmap with you all. So the goal of the webinar today, of course, is to share all of the innovations, the roadmap that we have to offer in the plan. And we did ask for a Q&A. So I will be going over some of those questions. Actually, probably all of the questions that we had, because I want to make sure we get to everyone. And there is a Q&A on the bottom of the webinar on the Zoom. So if you want to ask a question live, please click on the button and we will get to you as well. I do also have a special guest with us. So it's Kara from Next Level. She created the Business Builder program, and I'm grateful to have met Kara. And she's going to share a little bit about her program and how many therapists we have helped to actually start their journey on a business, including those that grow or want to grow their business to the next level. So I'm excited about that as well. All right, so let's see here. So I do have a small presentation, but I actually want to show HelloNote as well. So let's see where, maybe just make sure everything is set up. All right, so for 2025, I personally am excited for 2025, and I hope you are as well. So every year marks an opportunity for everyone. Okay, there's opportunities all around us to grow our business, and Kara will share a little bit about that later, because over 100 therapists have grown and started their business just with Kara's program. So that is awesome. And again, whether you're a new practitioner or seasoned, there's always room to grow. Okay, so I personally have had the pleasure, every day I speak to practice owners, and whether you're small, large, it doesn't matter. There's always that common vision where you want to grow your business. Okay, whether you have a full caseload and you're good, you always have something on the back burner where maybe you want to delegate and hire somebody else, or you have a practice with multiple locations. That is also something that you can grow as well. So to me, there's no limit, because I speak to therapists every day that run a practice, and I watch them on their journey. And that's what's exciting about my job here at HelloNote, is because I get to watch every single practitioner grow, ask questions, feedback, and personally, I do learn a lot as well. So I definitely learn a lot from every single practitioner. And, you know, like the insurance rules and guidelines, it's always surprising to learn something. And, you know, with us, we are very community driven. So every single feedback that we get from you, positive, negative, it doesn't matter. It all goes to our team and make sure that from our team, it goes to engineering, and then it goes to QA, and then we bring that to life. So we're very grateful for our internal team because they make it happen. Okay, so it's not myself or one person that makes things happen. It's a whole team behind the HelloNote product. So I'm grateful for them. Also this year, on top of being a milestone of actually getting to 2.0, getting everyone over to 2.0, we actually hired a customer success manager, which is exciting. And the reason for that is because we want to make sure that we're meeting our commitment to ensure that everyone is getting the product that you pay for, right? So we don't want to have any clients that are unhappy with using HelloNote. And if you are unhappy, you know, let us know for whatever reason. We're going to do our very best to make sure that we resolve your issues and we continue growing. And we're grateful that you chose HelloNote, and we'll do our best to ensure your success. So without you as our partners, we would not be where we are. So I do encourage everyone to reach out, especially now that we have a customer success manager. We can ensure that everyone's voice is heard, and we do our very best for you. All right, so let's see. Okay, I see some questions already coming in. So just want to give a heads up that I will get to those towards the end. Okay, so if you do have questions, no problem. Just put it in, and towards the end, I will answer them. All right, so, okay, so the first, so we have this slide up here. So I'm going to shift over to the next slide. Make sure. All right, here we go. All right, so the phase one of the HelloNote 2025 roadmap is something that we want to immediately focus on. Okay, so that's core features. So first is time-saving features. So again, from the very beginning, we focused on making sure that HelloNote has as many time-saving features as possible. Whether you're a therapist doing documentation, whether you're the administrator or biller, front desk, it doesn't really matter. We want to ensure that you're using HelloNote and it serves your purpose of saving you time. So we do always want to make sure that we're listening to you and how we can save you time. So feedback from our clients included templates, right? So we do have those autocomplete templates that I know therapists are using. Then we built out the note templates. And of course, that was a game changer because now you can preload all the data and preload it right into your note. So our next step is to leverage automation, custom reporting, and also we're going to be using AI to save therapists time on documentation. Okay, and then we're also going to be using that for billing purposes to track denial rates to ensure that when you're sending out claims, if there's a pattern, that you don't get the same rejections or denials. Also reimbursement. We're actually going to be tracking your average reimbursement per insurance per note type, because of course evaluation notes will pay sometimes higher. So we want to give you those metrics to ensure that you're billing properly and getting the most that you deserve. Also front desk. So front desk, we are always building out new features, reminders, tools that I'll go over in a bit on how front desk can use time-saving features. One of the biggest time-saving feature feedbacks that we have actually is using the instant messaging. So this way you can just communicate with your internal team, which is really, really nice. So next is patient engagement tools. So we have tools for improving communication and collecting patient feedback. So back in 2020, when the COVID pandemic happened, we actually had to rush to release our patient portal. And now, we're some time away and things have changed, right? So things have changed. The automation has changed, AI. So we do have plans to bring more patient engagement tools, including a kiosk, where a kiosk mode, I should say, that you can put onto your office on your front desk to automate that check-in process along with intake and consent forms. So that is really exciting, and I'll share a little bit more about that later. So of course, documentation. So best practices, creating fast, compliant, and comprehensive notes. And the keyword here is compliant, right? Because fast notes do not always equal to compliant notes. So we are also building out a tool where therapists will be informed of how similar their note is to prior notes. So this, I personally think this will be a huge game changer for not only the therapist, because therapists, I'm a therapist myself, we want to treat, right? We want to help our patients get better, but more from the billing side and running your practice side, you want to ensure that if there's an audit, that you don't get money taken away, right? So at the end of the day, it does all come down to insurance and reimbursement. If you're insurance-based, if you're self-pay, then you're in a good position where you don't have to submit claims to the insurance. So yes, compliance is extremely important. One of the major things we focus on is Medicare compliance, because a lot of insurances do follow Medicare compliance and guidelines. And in our software, you can trigger that on or off, and you can actually turn on Medicare compliance for other insurances, such as Medicare Advantage, right? So that always helps a lot if you want to just have an extra safety measure to ensure that you are compliant. And then real life success stories. So I'm gonna leave this to Kara towards the end, where she's gonna share about the Business Builder program, and she's gonna share some testimonials and case studies from current members of the program. So very excited about that, because it is just as amazing as it is to hear therapists grow in their career. It's also amazing to hear where a therapist was able to start their business and grow. And there were many practitioners that grew to multidisciplinary practices in more than one location. So that is always a huge achievement and accomplishment. So I'd love to hear that. All right, next is our phase 2. So billing automation. So one of the things we really want to focus on for next year's roadmap is to automate billing. So I mentioned that a little bit, where we're going to use AI to track your revenue and average reimbursement. But what does that really mean, right? So we can't, of course, therapists have to do their billing, right, within the note. So therapists will be doing their notes just as usual, but we are going to be building out more metric systems for the front desk billers or administrators to run and notice any patterns or anomalies. So with that, you're going to be able to see a graph based on how your therapists are performing, which CPT codes they're billing, which one is higher than your average, which one's lower. Also adjusting your fee schedule, because you also don't want to bill too high, you don't want to bill too low, of course. So there's going to be a lot of metrics coming with that. So hybrid billing solution is the next bullet here. So a lot of feedback that we get is, we're very fortunate to have majority of our clients do in-house billing, because it just shows us that the system is capable of that. And again, we take your feedback, we improve. We work with billing companies that give us feedback as well, and we're extremely grateful for that. And we like to have good relationships, of course, with any billers. So we are working with billers directly to ensure that billing is optimized, right? Because at the end of the day, billing is the financial component of survival for every business. So metrics, the flow of how notes turn into revenue is extremely important. So that's your RCM cycle. And with the hybrid billing solution, so I mentioned we have in-house billing. Of course, we have a lot of users with that, and billers that use our software. But there's nothing in between, right? So a lot of our clients are coming to us and say, well, you know, I have a biller who's doing XYZ for me, but they're not doing ABC. Or you have your in-house biller doing XYZ and they're not doing ABC. So one of the features that we are, well, I shouldn't say features, it's a service that we're going to be offering is called the hybrid billing solution. This will allow HelloNote to take on some of that heavy lifting and split the responsibility with either your in-house billers or your billers. So for example, you don't want to deal with the actual submitting of claims and posting payments. So HelloNote will actually take over. So we will do the submission for you. We're going to do the posting payments, and we can leave it up to you to, to call rejections or do eligibility or authorizations. So that's why it's called a hybrid billing solution, is because A, we're not going to do everything for you because you might already have a great person or process in place, and B, the cost, right? So one of the big key points here is cost. So a lot of the clients that reached out to us for a service like that, they didn't want to spend a lot of money on it, but they said, you know what, it would be good if you guys offered a service at a reasonable price instead of me having to pay an extra, $500, $1,000 a month for somebody else to do that. So it is a service that we'll be offering. I will actually share a link in a little bit where you can fill out a form and we'll reach out to you to collect information. And every business is different. Okay, so we have clients that are low volume. We have clients that have a lot of volume. So that's why we want to have a conversation to see what you actually need, so we can ensure that we can provide the service that you actually want or need for your business. So next is host a webinar to showcase how to increase revenue and reduce denials. So once we build out all of these automations and everything, we actually want to have a dedicated billing team to do webinars and kind of webinars like this with Q&A, where we can show you tips, tricks, whatever it is that you need to ensure that your workflow is efficient. Because billing does get tedious, right? So there's a lot of things that go into billing, but at the end of the day, it's a lot of it is just the same work over and over again. So if we can automate that, along with reduced denials, I think that would be huge for everybody. And life moves quick, so we want to ensure that you don't spend majority of your day doing billing, and you enjoy your time off with for yourself, for your family, for any other ventures that you have. So that is important. So next on the right, I'll talk about the front desk assistance. So if you have been to APTA, what was it, in October, you would actually see our robot kind of driving around. So we brought this robot to APTA to showcase a new kiosk option that we'll be offering, which is really cool. So the kiosk option will allow you to put a tablet on your front desk, and it's going to automate that front desk kind of package where patients come in, they check in, they sign intake forms, pay bills, even run eligibility. So the goal for front desk assistance is to have something that sits on your front desk, right? And having the patient come in, check themselves in, they can reschedule themselves, they can pay for whatever visits they owe, sign consent forms and things like that. So I think it's going to be a huge opportunity for a lot of business owners as well to kind of delegate what can be automated, okay? Because there's a lot of things that are done right now by a person that can be automated, because then you can free up some time and delegate some more heavier tasks, which would be really nice. So we're going to launch and train staff on the new kiosk mode, of course. So I know this is a big item, and I know a lot of our clients have been asking about that, when it's going to be released. So next year we do plan to release it. The robot, by the way, is not something we'll be offering. It's something that we just got for the conference. If you want to buy your own robot, that's fine. but it's something we just got to showcase how this can work. So we actually have a clinic that has a remote front desk. So they actually use a tablet for when someone comes into the office. So you can actually use the front desk assistance for that as well, which is pretty cool. So templates and scripts for front desk optimization. So again, training will be provided. We're going to customize the front desk assistant for your clinic because we do work with a lot of clinics that are cash-based only. We deal with a lot of clinics that are insurance reimbursements and, of course, hybrid. So not everyone is going to need the same features. So we will work with you and your staff to make sure this is optimized so patients can come in, quickly sign in, fill out consent forms if they already haven't, okay? Because we do have our online scheduling widget, which is really cool, and they can actually sign and fill out consent forms online before they come to your office. So we're excited to share, we're excited to share the front desk assistance for next year. So next, we're going into our phase 3. So upcoming features rollout. So key operational tools. So one of them is going to be the enhanced waitlist tool. So there's going to be automatic slot fill capability for no-shows. So again, I know a lot of you run busy clinics and you don't have time, or even your schedulers that you hire and work with you don't have time to follow up on every patient that is a no-show or cancellation, and there might be repeat offenders, right? So what we're doing is we're going to build out an automatic slot fill feature. So based on your wait list, if there's a patient that is a no-show, they can fill that, the system, HelloNote, will fill in that slot for them. So the patient will get a notification that a slot opened up without actually having to call that patient. So that's really cool. Next is custom referrals. So train staff on DME and equipment referral management. So right now, as you know, we have a feature called referral request. So we're going to be building on the referral request where you'll be able to add DMEs and equipment. So it's going to change the caption from a referral request to maybe DME request or equipment request, things like that. So that is that's also going to be rolled out. Average reimbursement tracking. So provide dashboards to monitor financial performance. So you may already notice that on our dashboard, we do have a KPI tracking. So this was only the kind of the first phase of launching it, where it's more static. So we took feedback from clients, like what KPIs are important, and we put that into the static widget. But for phase 3, for next year, we are going to be able to give you the power to customize it, because not everyone wants the same KPI, right? And I get it, because we run KPIs based on different needs, different business models. So we will be giving you KPIs and average reimbursement tracking based on your needs. Custom case types and notes. So if you are a current client of HelloNote, you know that we use case types a lot. So based on a case type, you can control whether something is Medicare B, Medicare A, self-pay, HMO, Medicaid, PPO, whatever it is. So it works great. There's no issue with it, except for scaling, right? So as you grow, we need the opportunity to grow as well to give you more case types, right? Because there might be case types that you want, custom ones that we just don't have because not everyone needs it. So we will be rolling out a custom case type feature. You'll be able to create your own case type and preload any billing and note rules for those case types. Also custom notes. Custom notes is also something that we've been looking forward to for a long time, where right now we have great note templates out of the box. They work for majority of clinics, but sometimes you want to customize something, right? Sometimes you want a specific note, like whether you're doing lymphedema, hand therapy, home modification. So, there's always something. You might want that extra field or box or date field somewhere in our notes. We used to have actually a customization option for that, The problem with that is it's pricey. Not only for us, it's also pricey, of course, to tell someone, hey, you need to pay for a feature. And it's not something we want to do. Our goal is not to get clients to pay for more features. So what we like to do is do more of a community approach where we build something out and everybody benefits from it. And that's how we've been doing it since the inception. That's our model. So we will be working on custom note templates. And with custom note templates, we will allow kind of a cross-office sharing. So you'll be able to share it with another office, whether it's your office. And if you're okay with it, then you can actually share it to other offices. So we are going to be building a kind of a community of custom notes. So if you built out a nice template for yourself and you're okay to share it with others, then I'm sure every therapist would appreciate that. So and same goes for those other therapists; they can share with you. So we are excited to build out custom note templates. So next is patient-centric enhancements. So again, a lot of features that we want to work on is to enhance more on the patient side, so you don't have to do that, or your staff doesn't have to do that. So appointment reminder confirmations. So this is something that has been requested. Now, I think this year we actually had a lot of requests for that. I don't know why this year we got this request as opposed to starting from last year. But essentially, this will allow patients to click a link within the appointment reminders to confirm or cancel their appointment, which is a great feature. Actually, I have my accountant actually uses this feature, and it's very seamless, right? I get a notification and I click yes to confirm, and then my accountant knows I'm coming. So same thing here. Your patients will get an appointment notification reminder as they normally do, and you can turn on a feature, and this will be optional, by the way. So you can turn on a feature where the patient can click yes to confirm or no to cancel or request a new appointment. Okay, so that is going to be really nice feature. Next is custom intake and consent forms. So this has been a wild ride for us because we really wanted to bring this out already for quite a while, but we're finally nearing the finish line for this. So we do have intake and consent forms that are customizable. However, we do that customization, meaning you send us the forms, we customize it for you, and we load it into the system. Now, if you want to make a change or something like that, it has to go through us currently. So with custom intake and consent forms, you will now be able to design and create your own intake consent forms. And on top of that, we are going to make the fields dynamic, where you can actually select where they preload. So for example, if you're doing an intake forms with patient demographics, and then you're getting to the section that says, let's say, insurance ID number, you can actually map it back into the patient's chart automatically. So right now, when patients fill out intake consent forms, as you know, it uploads a copy of it into the Documents tab, which again works. A lot of clients use it, they're fine with it, but we do want to take it to the next step, which is dynamic, right? Making all the fields mappable so you can select where in the chart this will go. Okay, so I think that will that's going to make a lot of people happy on this, and patients will be happy that they don't have to refill out paperwork because it's going to generate automatically into the chart. Also with credit card capture. So one of the other big components we're going to be adding to this is a credit card field. So you can collect patient credit cards right on the intake form. And once they fill it out, it actually gets preloaded. Just make sure it's in your consent form that you'll be capturing credit cards, of course. But otherwise, it's going to capture all of that and send it right off into the chart. The map feature. The map feature is location-based planning and task management. So if you notice currently, or if you're doing the calendar on HelloNote, there's a button that says Show Map. So what it does is it takes the view that you currently have and opens up another window, and it loads a Google map of where your patients are, right? So it plots them out, and it also color codes it for the discipline. So I know a lot of mobile-based practices are very thankful for this feature. And I've been hearing that non-mobile practices are also thankful for it because they could see where their patients are located geographically, and they can make business decisions like opening up another practice, doing more marketing in other areas or within that area. So that is a cool feature. And then front desk assistance. So I mentioned that on the prior one. So it's going to be more seamless for patients to check in and schedule their next appointment. The next is security and AI tools. So note locking. So this feature actually came from HelloNote 1.0. This ensures that your therapists are doing notes on time, and you're going to be able to control a kind of a threshold on how many hours until they cannot do the note anymore. Because, again, as a therapist myself, notes are not always on my, priority list. And I know most therapists agree with that, where they don't do notes on time. But, for billing purposes and running your practice, of course, that is crucial, right? Because if you don't have steady cash flow, then, your business cannot survive. So with note locking, we're going to be able to specify a time limit for when your therapists are allowed to do their notes. And if they exceed that time, then they have to go and more at the administrative level, which I know therapists don't want to do. So they're incentivized to do their notes on time. Next is EVV with GPS tracking. So electronic visit verification is getting a lot more popular. So as much as we don't want that, unfortunately, that is where kind of the industry seems to be heading, especially with Medicaid. I know they launched that. So we do have a lot of practices that bill Medicaid, and they need EVV to be compliant with Medicaid. So as you know, if you're a client, we do have the patient signature module for every single case. So you can collect patient signature, but we don't have a GPS component, meaning it doesn't track your geographical location. So we will be launching a feature with GPS tracking to give you full EVV kind of compliance if you need it. So that is something coming as well. Next is AI note tools, intelligent assistance for faster error-free documentation. So again, with AI, there's so much, I also think over the next few years, things will get AI will get more, better, stronger because it just learns based on itself and the data that it's given. So we will be implementing more AI tools. And I did mention that we're going to be launching a feature that tells therapists how similar their note is to the last note, okay? Because it is crucial for notes to be different, right? Because you don't want to have the same exact note session to session. So it will give a therapist an alert on that. Next, financial systems, emailable statements with auto send. So this is actually really, really cool because we didn't have an option for emailable statements. So if you wanted to print a statement, it would have to be a PDF, and then you can do whatever you need with it, either print it, mail it, show it to the patient, whatever you need to do. So with HIPAA compliance, we always have to be careful. We want to ensure we're compliant so this way we can provide the maximum security and compliance for you. So we are building out an emailable statement option, which will allow patients to get an email with a secure link, and they're going to have to verify, of course, their identity, and it's going to show them the statement. So I'm excited about that. And on top of that, it's going to automate sending the patient receipt. Invoice and receipt. So for example, if they didn't pay their bill or something like that, you can set up a threshold where when does it send to the patient a reminder? So do you want it to send after 2 days, 3 days, 7 days? It's going to be your call. We're going to have a customization for that. Next is automatic ERA posting. So I know a lot of you have been asking about that, and I can finally let everyone know that we do have this up and running. So we had to build out a few key details, and we are doing more for this, but we do have it up and running. So if you want this, or if you already reached out about it, will reach out to you. So you don't have to reach out again. But if you have not reached out about it, please reach out. And the reason it's important is because we need you to know that we activated this for you, because we don't want double posting, right? So if we're going to enable this feature, that means you no longer will have to go into the clearinghouse, download the ERA, and import it back to HelloNote. It will automatically take the ERA from the clearinghouse, put it into HelloNote, and then it'll be up to you to post your payment. Okay, so that's also huge news, because I know a lot of people were waiting for that, and we're finally excited to launch that. Next is prompt paid discount to incentivize timely payments. So we are building out more tools for these discounts, including super bills. So when you print out a super bill, it's going to have an additional line items with what the patient pays. So this way they can be compliant with getting reimbursed from the insurance. All right, next slide. Let's see. So phase 4, advanced analytics and customization. So patient status board with dragging. So with this feature, so we have a patient status filter that I know a lot of you are using. So you can run reports based on different patient statuses, right? So you can create your own statuses. You can see which patients are active, inactive, on home health, whatever it is, on Part A, whatever the case is. It's all customizable. And there is a report for that. So we actually have a new feature coming out that's going to allow you to visually see a board with a vertical view of where your patients' statuses are, and you can drag and drop as you need. So I'm actually very excited about that, because I use something similar for kind of different components of tracking. I use other softwares for that. So bringing that into HelloNote for patient tracking, I think will be awesome for a lot of you, just to ensure that you know which status your patient is on, and you can easily move the statuses from one column to another. So that's really cool. Static event categories with default colors. So with this, we're always trying to improve our schedule. And if you've been with us from 1.0 to 2.0, you know how much more of the schedule kind of features we rolled out. And again, this is thanks to all the feedback that we've been getting, because it's not easy catering to every single client's needs, right? And it's our job to listen to that feedback and build something that works for everybody. So extremely grateful on that feedback. And one of that is more like color coordination. So with static events, we already have the feature where you can predefine categories. So you're also going to be able to customize the colors, which is going to be really, really nice. You don't have to remember which colors go for which category. Next is adding and removing new users. So also something that's been on our roadmap for a long time. And I can finally say that we are almost done with this. So I actually think quarter one, we actually will be releasing this. Hopefully January, I should say, you will be able to add and remove your own users without having to reach out to HelloNote. So I'm excited about that. I know our support team is excited for that. And I know you are excited about that, because you don't want to reach out every time you want to add a new user or remove a user. So you will be able to add your own users, remove them as you need. Next is customizable dashboard. So we spoke about this before. So we are working to give you the power to create a dashboard that works for you. Okay, so I know everyone wants something different, and we have a ton of reports in the system already. So we are going to be working on little widgets that you can create from the report into a widget. So if you want to see how many cancellation notes there were in the last 7 days, you can drag a widget for that. If you want to see what's your top insurance payer in the last month, you'll be able to drag a widget. So we're working on full customization of the dashboard. To me, this is one of the most powerful things, because running reports takes time, right? As many reports as we do have, and as important report running as it is, we do want to take it to the next step by giving you the power to see all your reports that you want in one area as opposed to running them individually. Now, again, this doesn't mean you're not going to run your reports. It just means you're going to have a shortcut to kind of have a bird's eye view of what's important. KPI dashboard. So that ties in with the customizable dashboard. So you'll be able to place on top of reports. You'll be able to place any KPIs that you want as well. And we're always listening to feedback because KPIs vary so much from different offices. So I do want to make sure that we give you the opportunity to create your own KPI dashboard. So if you have any feedback on KPIs or what you want to see, just let us know so we make sure that that is available. All right, and then for phase 5, ongoing support and feedback. So that's always going to be something on our priority and making sure that we listen to our clients and that we roll out features based on your needs. So Q&A. So I do want to go over a little bit about this. So actually, I want to show you guys some of the new stuff before I go into Q&A. So let me bring up HelloNote. One moment. I already have it logged in, so I just want to show you some stuff. All right. Okay, so you should be seeing my screen here with HelloNote open. So a few things. Let me go back to the dashboard. So from the dashboard here, I do want to mention to everyone, because one of the biggest feedbacks that we have is you want to know when new features come out, right? So it's our job to make sure that you do know when new features come out. So please make a note to look at the what's new section, because you could see here as you scroll down, we do update the system often, right? And I don't just mean updating the system from any issues or bugs or glitches like that. Of course, we update, but we want to showcase all the new features we have as well. So please make sure you're going here, because we have so many features, and I'll be honest, it gets very tough to ensure that every single one of our users knows about that feature, right? So we do want to do more webinars. We want to send emails out. We're putting this here, so we're doing our best with that. Just please make sure you're looking at the dashboard for any new features, because a lot of times we have a new feature and then we get a request for the same feature. So we want to do better to ensure that everyone knows about any new features that already came out. So please take a look at this, and if you really don't have that feature, of course, reach out. So we'll be doing more on that. From the next, so going on the left side to the patients. So here, this is a dummy blank office here. So we're adding, little minor enhancements as well into the system. Like, for example, the primary care physician, we just added like a shortcut. So if I click on that, I do want to make sure everyone knows that it will bring up the patient and referrals for you in another tab. Okay, so you don't have to kind of lose your place here. So if I go to settings, for example, and then I scroll down and go to PCP/referral, so it loads up for me. But now I lost where I was. So I want to make sure everyone knows that you can open up different tabs, whether you're on the schedule or the patients or the notes, whatever you want to do. We are cloud-based. So with cloud-based, we want to make sure that we optimize or we utilize all the features of the browser, which includes opening up new tabs. Okay, because that is some of the feedback we get is like, oh, how do I open up a new tab so I don't lose where I was working? So another shortcut for that is there's a button on the top here called Duplicate Current Page. So if I do click on that, it'll do the same thing. It's going to duplicate the page that I'm on, so you don't have to lose your place. Okay. Also, the instant messaging on the top. So I do encourage everyone to use that. I know we have a lot of great feedback on that, so please make sure you're utilizing that. You can add any user, click on the user, you can chat back and forth, whatever you need. And of course, it's HIPAA compliant because it stays within our system. So yeah, make sure you use that. Next is on the bottom left, I do want to mention our help button. So you can call us, you can email us, and of course you can use the online chat, right? So, well, it's an online ticket system. So for example, if I put in here, let's say copay, it's going to give you some results of copay. And then we do have a knowledge base now that our team works really hard on to ensure that any questions are on the knowledge base. So this way, if you can find self-help, you can do that. And if you can't find what you're looking for, of course, click contact us, and we'll get back to you with the ticket. Now, one of the other huge things we added is the knowledge base, right? So our customer success manager, he actually helped us implement that. So with, let me end the slideshow. There we go. So with the knowledge base, it allows you to track your tickets, right? So aside from just submitting a ticket and having it in your email, we do now have the capability for you to track your tickets, where your tickets are, right? So which is extremely, extremely important. So here I actually have it open here. So with the knowledge base, you can go to support.hellonote.com. Just create a login for yourself, and then from here you can track your own tickets, and then we have a whole bunch of knowledge base articles. Okay, so you can look at the articles, whatever you need to do. So please utilize that. Again, not to say that we won't answer your question, but a lot of feedback that we have been getting recently is that the knowledge base has been a super helpful tool for everyone, not to have to reach out to anybody and just kind of look up the question. Okay. So aside from the knowledge base, we did rework our IVR system. So if you call us, you'll see that the menu option did change, and also you can essentially, if it's a busy time of the day and nobody's picking up the phone, you can actually press a button to leave your callback information, and someone will call you back instead of having to wait for someone to answer. Usually this doesn't happen, but again, sometimes there's peak hours or whatever it is. We want to ensure that you don't stay on hold for a while. Also integrations. So I do want to mention integrations. So let me go back to the patient tab. So one of the integrations that we have had is the home exercise program integration. We are going to be announcing a new home exercise program integration, which is going to be really cool. So there's going to be some big news on that. So we'll have another webinar specifically on that, and it's going to tie in with RTM. So it's surprising to me that a lot of therapists and clinic owners don't know about RTM yet. So I'm very fortunate to know about RTM, and that I know that it can add more financial income to your business, right? So we do support RTM, but we will be enhancing the integration, so you actually have an RTM platform to use with HelloNote. Also, a CRM software. So we have been looking and making sure that we're integrating with the CRM software. So if you do have a CRM, we'll be announcing also an integration with one, so you can use it with HelloNote. Artificial intelligence integration, so I spoke a lot about that. So there's going to be a lot of cool stuff on that. Also scribes. I know there's scribes out there that help you with documentation, so we're excited to integrate with more scribes to make documentation more seamless. All right, so next, so we spoke about, so the other thing I wanted to mention is the schedule widget, right? So from the system here, if I click on the intake, consent and intake forms here, you can send intake and consent forms to your patients. But one feature we already have up and running is the online scheduling widget, which allows patients to book an appointment directly on your website. and they get a link to your intake consent forms to sign. So you actually don't have to do this process if you enable that. So please, if you have a website and you want patients to schedule online, let us know and we'll generate you a unique link that's secure for your specific website, and you can put that on your website. All right, so next, so credit card processing, we spoke a little bit about that. So if you do collect credit cards, you can go to the Payments tab, and you can actually click on the credit card profile button. Okay, if you are not enrolled with credit card services, please reach out to us and we'll point you in the right direction. But yes, you can store credit cards with HelloNote. It does require an integration, so we'll send you all the details, and then you can sign up for that if you need to. Let's see here. So eligibility is another big component that we've been getting asked about. And I know a lot of you already have the eligibility feature within HelloNote, but I want to kind of showcase it for those that don't use it or don't have it. So let me bring a screenshot into view here. So this is something I ran right before the meeting. So just to show you that it has a lot of data that you can get just by clicking a button, right? This is actually a private insurance. This is Cigna, right? So I took out, of course, the patient information, but you can see here, it tells you exactly what's covered in network, out of network, therapy limits, out of pocket, whatever it is. So please use this. I mean, you know, checking eligibility is such a big component of running a practice. If you are insurance-based, of course, you know, you can use this to simply run eligibility. I think it takes a couple of seconds to generate the report. And then on the bottom right, there is a button called Upload. You can always upload this to the patient's chart for future reference. Also, this works with Medicare. So with Medicare, it's going to show you like home health, if there's Medicare Advantage, deductible, all of that. So please, if you are not using it yet, consider using it because it's going to save you a ton of time. And we are going to be adding secondary eligibility as well. Okay, so we're going to be adding another button for secondary eligibility. Majority of insurances are already working. If there's an insurance that it does not work for, just let us know. We will tell our vendor, and they will do their best to add that insurance. But yes, I do encourage using this feature here. All right, next question. So map feature, we already spoke about that. Custom notes, we spoke about that. We do have a feature. So on the left sidebar here, there is an announcement feature. So this, of course, does require you to sign up too. So with this feature, it's going to allow you to email, e-fax, or SMS blast your patients, providers, or internal team. Okay, so if you are interested in that, send us an email. We'll get you set up with that. Again, we need to know your needs as far as how much volume to know what price point you have to be at. But this is a great feature without you having to sign up to another software. That's most likely more pricey. Okay, so next is emailable statements. So we spoke about that, and the kiosk mode, we spoke about that. So let's see. Trying to get to all the Q&A here. Okay, so one of the other questions is please review how to run reports. So we can spend, of course, a whole session on reports. So I don't mind doing a whole session on reports, but just to quickly show you, when you go to reports on the left, make sure you click on whatever report you need. And then if you click on this heart on the left, it's going to add it to the favorites. So if you see here, I chose favorites. These are all my favorite reports. So please make sure you're using that, because we do have a ton of reports, and some of them might be more on like your favorite side. So you don't have to go and search for them. All right, next is where can you access the revenue generated? So once again, this is in our reports. We actually have a report called Revenue. So make sure you click on that, and then it has all the filters and whatever you need to run your revenue. Can we create a report for therapist caseload? So we do have a report for that. So that is located, that's going to be in the, let's see, so note and compliance, active cases, and lost patient. So this report here will show you exactly the therapist caseload. Under the column with therapist, it's going to show in parentheses how many cases the therapist already has. So this is the perfect report for running therapist caseload. All right, so next is a report for productivity, recertifications, and progress notes. So we do have the notes report. Also, it's located under note and compliance. When you click notes, you can actually filter by any note that you want. So this is a very useful report for that. Next is net income and KPI on dashboard. So that KPI already exists. So if we go back to the dashboard, so right here, it does show you your revenue. It doesn't, well, I guess the question is more on the net revenue. So that's a good KPI to add. So we can always add it. This right here will show you your gross revenue for now, at least. Let's see. So better filters for patient responsibility report. So great feedback. We'll rerun the patient responsibility report, and we'll actually reach out to this person who asked this, and we'll get some feedback as to what we can add. All right, so next is how to create comprehensive invoice when billing a credit card. So this is all from the Patients tab. Then we have the Visits and Receipts. Okay, and from here, you can click on whatever visit you need, and then click Options, Print, and you can print out any of the statements. Okay, so if you want something more comprehensive, please let us know exactly what you want to see, and we will be happy to work on that. Next is, can private pay clients be sent bills with credit card payment options? Yes, you can, as long as you sign up to the credit card processing, you can send your clients a payment link without any issue. Also, with how to take credit cards and send invoices, so same from here. You can also click the Actions button, and as long as there's a balance, you're going to have an option to charge credit card. So let's see. So for this one, I'm going to quickly show you because we already have a payment, so the balance is 0. I'm going to change this to 100, save it. So now if I click Actions, you'll see here I have charge credit card. Okay, so if I click charge credit card, well, I don't have the feature activated on my dummy account, but you will, as long as you sign up for the credit card processing, and you'll be able to use that. Or one of my favorite features is send payment link. So send payment link will allow you to send a link to the patient, and the patient does not have to log into any portals. It's very seamless. They just get a link, they click on it, they pay, and you'll get an alert, an email to say that patient paid. So that is a nice feature here. All right, so next one. So there's a few other invoice questions. So if you have more invoice question specific ones, just let us know, and we'll be happy to work with you on that to ensure that your invoice questions, whatever you need, is in the system. Next question is, can we customize templates and share them among the team? So yes, that's one of the phases we spoke about. We will be building out custom templates that you will be able to create, and you'll be able to share it with your team. And if you want, you'll be able to share it to the HelloNote community with everybody else. So that is really a really cool feature coming out. There's a few questions on, there's quite a lot. There's like 7 questions on customizable notes. So same answer to that. It is coming. It is on one of our high priorities. So for the 2025 roadmap, this will be done. Same thing for intake consent forms. This is actually almost near completion. So custom intake and consent forms, we're hoping to roll out sometime around January, I would say. So hopefully next month we'll have it up and running. Allow uploading and customizing flow sheets. So I'm not really sure what this question means, uploading and customizing. So if you go on the left side to settings and you go to flow sheet, so you can press new and you can add, whatever flow sheet options you want. One new feature we added here is the CPT code reference. So if you select this, and then on your note, you select that flow sheet, it's going to automatically populate into your comments of that CPT code, which is huge. So that is nice. Next is copy paste feature for scheduling appointments. So we actually had that request from a few clients already, and it is already on our engineering board. So that means it is being worked on. So we are anticipating it to be released hopefully soon. Allow opening notes without finalizing the previous one. So we do have a feature for that. So I personally don't recommend it because I want to make sure therapists finish their prior notes before starting new ones. But if you go to the update case, let's see here. So in the note rules, so it's not a default here because actually, yes, it is right here. It's called disable carryover. So if you want to use this feature, just let us know because we have to enable it for the office that wants it. So what this will do is it will allow you to open up multiple draft notes without having to finalize the prior one. So the feature does exist. I know majority of clinics don't want to use it, but if you do want to use it, let us know, and we'll enable that for you. Next one is graphs on dashboard. So graphs on dashboard gets tied into the custom dashboard, so you'll be able to customize how your dashboard looks. Next is streamlining time in out documentation. Not sure what that question means, but time in and out documentation. Not sure, so we'll reach out to this person to get clarification. One thing I do want to mention is that from the schedule, you can now open up a note directly from the schedule. So keep that in mind. That is a shortcut. Tablet-friendly app availability. So an app is in the works. We are working on something for an app. So it is part of our 2025 roadmap. Next is pop-up schedule when opening patient notes. So again, let us know what issue you have with that, and we'll take a look for you. All right. So next is option for text communication. So I think what this means is you want to be able to text your patients back and forth. We haven't had a lot of requests for this feature. So if this is something important for you, let us know so we can look into it and build it out. We're never opposed to adding any type of feature. So let us know if it's important. Next is kiosk patient check-in for self-scheduling. So yes, that is coming. Patient portal updates for file access update. File access / upload. So we do have a patient portal, and they do have the option to upload a document there. So if you have any issues on that, please let us know. Next is dictation feature for documenting on the go. So for dictation, first thing, if we go to the information tab, there is a action button on the top called Dictation Service. So if you click on this button, it's going to open your dial pad, and it's going to, and you can actually save this number that it's going to open. So it allows us to transcribe the note. So this works based on kind of leaving us a voicemail. So you leave us a message, it'll give you instructions, and then we transcribe it for you into a draft note. So the next phase for this is going to be more on the scribe side, where you can just speak your note right into the system and it transcribes automatically. So that is coming. Next is best resources for learning HelloNote functions. So yes, this is a great question. And that's where the Knowledgebase comes in. So please register for the Knowledgebase. We also have a YouTube channel. So we're going to do our best to update it more timely. And, no feature I think is too small. So we will do our best to update the Knowledgebase and videos with every single feature. Training videos. So yes, same thing. We'll be doing our best for that. Quick review on checking Medicare eligibility via Inovalon. So if you're using Inovalon for the clearinghouse, they have their own eligibility checking system. So if you have any specific questions on that, what you want to review, we'll reach out to this person and we'll do a training. Okay, next is Google Calendar two-way sync. So this is something we've been working on for a while. We just have to ensure HIPAA compliance when it's a two-way. So it is something that's already in the works. Okay, ERA auto import. So yes, we finally are launching the automatic ERA importing. So reach out to us, let us know that you want this, and we will get it done for you. Apple Calendar integration, same thing with the Google Calendar. We are working on that. Right now, we do have the option to export your schedule into your calendar, whether it's Google or Apple. It's just not a two-way sync, at least not yet. So that is something coming. Talk to text options. So that goes back to dictation and a platform with a scribe. So we are working on that. As you know, there's a lot of AI scribes out there. So a lot of them do work with HelloNote. So you can definitely use those, but HelloNote is working on something more native as well. All right, so next is tracking service tickets in HelloNote. So yes, so same as the Knowledgebase. So please sign up to the Knowledgebase, and you'll be able to track your existing tickets, which I think is a great option. All right, so the ability to transition old evaluations to HelloNote. So I think what this means is if you're coming from another software, you want to import those evaluations into HelloNote. There's a few options for that. Number one is you can always upload it to the Documents tab. Number two is depending on the software that you're coming from, there may be a way for us to import it. We just have to make sure that the fields align. So reach out to us, let us know, and we'll be happy to look into that for you. All right, so next is highlight new features and routine emails. So yes, we will be working on more frequent emails. And then, of course, look at the dashboard as well, just to ensure that if there is a feature, then we put it on the dashboard for everyone to know about. All right, next is a customizable tracking checklist for to do and done. So for this one here, we actually had this on our coming soon list for a while. So we do plan to finish this patient checklist to do for next year. And also you do have this create event button on the top. So I love this option because it allows me to create an event, and then you can also keep track of its complete, incomplete, pending, or void. And you can, of course, put in a reminder date and time when you're going to get an alert for this. All right, next is, we spoke about the app on the tablet. Another question is, do you help with credentialing? So we don't directly help you get credentialed, but we do work with companies that will help you get credentialed. So please reach out to us and we'll be happy to connect you with them. All right, so good. So then we have a question on Plan of Care signature changes with Medicare. So I do want to encourage everyone also to go to our website with the so if you go to resources and you go to articles, so we do have a whole bunch of articles and we do try to update them very frequently. So you could see here We actually had one today that we did. So you can see here, it's pretty frequent that we're doing articles. So this one here, so the Medicare final rule updates. So you could see here the reduction in conversion factor changes, the certification requirements for therapy plan of cares. So this is really important, and this matters a lot, especially if you're billing insurances and tracking plan of cares. General supervision for therapy assistants, caregiver training codes, and expanded telehealth flexibility. So yeah, so please please look at our articles, and we do try to keep up to date on everything. And then we do have a question on how to, some more information on like hybrid billing. So I actually have a tab here open. So one of the things we're working on is to give you more kind of benchmarks on billing. So we already created some metrics and things like that. So if you are interested in that, just fill out this form. And then when we send an email to everybody, we'll include this link here. So then just fill everything out here, what role describes you, and then which billing related inquiry do you have? You want to manage billing, hybrid, in-house, or just the billing consultation? So I think this is going to be great for a lot of clients. All right, so let's see what else we got. All right, so a lot of good questions are coming in. All right, so before I go into some more questions that came in, I do want to make sure that Kara is almost ready. Yeah, sorry, Kara, we kind of going a little bit over. Let's see here. Let's make sure. Kara, are you there?
I'm here.
All right, awesome. I'm just going to go through a few more, and then we'll definitely give you the microphone so you can share. All right. So let's see. Okay, so some other questions. Let's see. Secondary payments. So I know a lot of clients have questions about kind of like secondary payments. So as part of the new billing enhancements, we are actually working on a full integrated billing solution. So this way you actually don't have to leave HelloNote to go into the clearinghouse, which is going to be really nice. So that is going to be an update for secondary payments. So please bear with us. We'll get that done, and we'll make sure that secondary payments are easier. Typically for many of you, the secondary gets crossed over, but I know sometimes it does not get crossed over. So and there is a way to do it from the clearinghouse. We have step-by-step instructions, but of course we want to automate it. We don't want any manual work. All right, so someone asked about the kiosk mode. So yes, that is coming. And then someone asked, could the front desk kiosk be set up for remote use for in-home mobile therapy service providers? Yes, absolutely. The kiosk mode, you'll be able to just log into HelloNote and turn on kiosk mode. So whatever device you're on, you'll be able to use it. So whether it's in a physical location or your mobile, it won't matter. Okay. Okay, so next is about the 30-day progress note, specifically for a state. So we do have a feature for that. So it's in the notes. So when you go to the case settings on the bottom, there is a checkbox for 30-day progress note. So you can utilize that if you need it. Otherwise, you could turn it off because, like, for example, Medicare as an insurance doesn't require it, but maybe your state requires it. Next, I am not able to join from the beginning. Will the recording be shared? Yes, the recording will definitely be shared. we'll send everyone an email with it. Okay. So there's a question about providing mobile therapy services. So we have a lot of clients that are mobile. So if you have any questions on any issues that you have, please let us know, or we'll reach out to you just to make sure we answer your question. Can the appointment reminders be customized? So yes, if you go to the information tab, so on the right side where it says appointment reminders, clicking on this plus button, whether it's email or SMS, so this allows you to customize the message. Just make sure you use the placeholders because you don't want, the patient name or anything like that appearing. So select whatever placeholders you want, and this will customize your message. Next question is intake form. Can a credit card authorization form be part of the intake form, or that's not protective enough? So yes, the dynamic intake forms we're working on will allow for a credit card field. So that is something in the works. Next, does the mapping feature only allow for 1 day at a time or for all patients on my caseload? It should allow for all the patients on your caseload, so whatever is in view. So whatever patients are in the view, clicking on the map feature should open up all of them. So if you are in day view, it'll open up for the day. If you're on week view, it should open up for the week. So schedule map is only going to work if you use the schedule in HelloNote. If I do not use the schedule in HelloNote, is there a way to see the map where my patients are located? So yes, we actually implemented that in the active cases lost patient. So if you go here, there's a show map button here as well. So you don't have to use the scheduler because we do know we have a lot of clients that are mobile based. So you can click on show map directly from here. Next, who will the emailable statements be marked as coming from? My patients don't understand that HelloNote is me and may not open at all. So this is a great point. So the email from will be HelloNote, but inside the email will actually have your header. So it's going to have your logo and all of that in there. Because yes, we don't want patients to reach out to us if there's a reminder or a statement or something like that. So it will have your office information, including the logo on it. Okay. So next, can there be a HelloNote webinar training like this for all HelloNote features? Yes, I would love that. So we are trying to finalize this year just to put all the features together, and we will do more webinars with Q&A because we want to hear these questions. I think these are really important. And then if you have a question and somebody else didn't think of about that question, I think it benefits everyone as a community. So yes, there will be that. All right, next is patient with pre-authorizations. Is there a feature to put in their authorization period and then remind front desk therapists that the period is coming up so they can do a recert? So yes, we are going to be linking the authorizations to the patient events. You can quickly add an event with authorizations. So this way you can get a reminder as you need. Let's see. For the new features, it would be neat to have a link where we can click to see a quick demo of the new feature. Yes, I agree with you. That's something we're working on the Knowledgebase. So as the Knowledgebase grows, we're going to be doing a little video. Again, sometimes these videos are not longer than 20, 30 seconds, but it showcases the features. So yes, we are working on that. I can't use the duplicate page when I have the incoming fax open. So we'll reach out to you. We'll see what the issue is there. I just purchased a fax machine. Can I send and receive faxes through the system, for instance, incoming referrals from doctors? Yes, if you want to use a fax machine for that, that's no problem. We just have to put in the fax number into your header so everybody knows to send you there. Someone asked for the website of the Knowledgebase, can I use my regular email and password? So no, because the Knowledgebase is run through Zendesk, which is another vendor for support, you just need to create another login for it. So it's not the same as HelloNote. Okay. Can you be integrated with PT Wired for RTM? There's always a possibility for integration. It just depends on the company, if they're willing to integrate and how many users we have using it. So we do have something for RTM in the works as well. So we'll be sharing that soon. Is there a cost to running eligibility? So if you have a billing tier, any billing package with us, then there's no cost to run eligibility because it goes into your tier. So if you don't use it, you don't get charged for it. And if you use it, then it just goes into your tier. And if you cross your tier, you go into the next tier. So I do recommend signing up. Again, there's no commitment also. If you want to sign up, try it out, try it out. We'll set you up for that. And if it doesn't work, then we'll take the plan off your account. All right, so next, what are the costs to have the auto submit for billing and eligibility checks? So reach out to us on that because every client is different. Everyone has different volume and your needs. So reach out to us and we'll put together a package for you. Please show the eligibility button again and where to locate it. So yes, absolutely. So let's go over that. So when you click on your patient and you go to insurance, you're going to see here there's a check mark on the right side. So click on that and it's going to open up the eligibility kind of portal. Not portal, it's a pop-up. So it doesn't take you anywhere outside of HelloNote. It just runs the eligibility. Next, my eligibility only runs for Medicare. Do I need to enroll for other insurances? Yes and no. Some insurances will allow you to use your Medicare P10 to run it. Others do want you to be enrolled for the for the insurance. So it really depends, but you can reach out to us and we'll take a look. Let's see. Does the announcement feature act as an SMS system so we can reply to the people that have a conversation, or is it a one-way broadcast? So right now it's a one-way broadcast. Two-way communication is something that we have already in the works. We don't have a lot of clients that have asked for it. So if it is something important to you, let us know so we can prioritize it based on everyone's needs. Did you say RTM is already available? So we do have RTM notes within the system. We actually have an RTM integration coming, hopefully in the next month or two. So that's going to kind of make things a lot more easier, and we'll make an announcement soon on that, and we'll have a separate webinar on it. Let's see. Is there a way we can get a push notification or text on our phone to indicate that we have a message waiting on the EMR? So yes, we actually, I don't know about text, but we are working on something for email. So we'll be able to push you a an email notification that you have a message. If you want SMS, again, we're never opposed to adding anything. Just let us know that it's important to you. For you, it sounds like it's important, but if there's others that is important, just let us know. And this way we can add it to our engineering list. How can remittance advice be automatically integrated from pairs without having to view them for each pair's site in Inovalon? So we do have the feature that we rolled out with automatic importing. So if you need it, please reach out to us and we'll reach out to you to enable that as well. Any updates to the intake consent forms? So yes, that is going to be the dynamic intake consent forms, and I hope we'll have it live next month. Next is, can we co-sign all notes directly from the dashboard instead of going into each patient chart? Yes, well, not from the dashboard, but absolutely you can go into, so when you go to your dashboard, let's see here. So the section that says pending cosign right here. So if you click view all, on the top right, well, I don't have any examples here, but on the top right, you're actually going to have a button called batch cosign. So you absolutely don't have to go into every single chart. Just click batch cosign, select all the notes you want to co-sign, and done. Next, so any more updates for HippoScribe to make recommendation of goals and ICD-10 codes? So we will reach out to HippoScribe to see, the features and updates on that. And I know HippoScribe works really well with HelloNote, so definitely look into that if you're looking for a scribe. If you disable carryover, does the extra note you open not have any info from the previous finalized note? Yeah, exactly. So if you disable carryover, it's not going to pull in the info because we don't know which draft note you want to pull in the notes from. Okay, time in and out. There's too many clicks to get to each section. That's good feedback. So if you want us to make it easier, we'll review that. We'll see where we can make that easier. Okay. Next, is there a location for the timeline of it's in the works? For instance, the app, Google Calendar. So we are working on a timeline. At this point, we just finished our HelloNote 2.0 migration. So, as exciting as that is for us and to everybody, I know you want to have timelines and all the features. And believe me, we want to put timelines on it. Everything's on the 2025 roadmap. So, of course, we want to get things done rather sooner rather than later because we have a lot of cool stuff planned. And we want to have more capacity for other stuff planned, like new feature requests as well. So, so as far as the timeline goes, I'll definitely work on something. We'll definitely put something together where we have like a feature and expectation time, and we'll share that. I just don't like to speak for the engineering team because they do an awesome job with rolling everything out. It's not easy doing that, especially with testing and all the requirements. So I don't like to put timelines on things, but I'd rather beat an expectation rather than meet it. So I'll work on something for that. How do you sign up for the knowledge base? So go to support.hellonote.com and click sign up. Okay, next question. Where does the alert show up when you have a pending event? So on the dashboard, it's going to show up there. So if you scroll down a little bit, we can also enable the emails for that. So you can get a daily email of your alerts. If you want to sign up to that, just let us know and we'll enable that for you. Another question about 30-day progress notes. So I already spoke about that. Okay. Let's see. So user says the 30-day progress note tab is not active. How to activate it? We'll reach out to you just so we can make sure it's active on your account. To collect credit card information for the new dynamic intake fields, do we need to be signed up with credit card processing? So yes, because credit card processing requires PCI compliance. So we have to ensure that all the compliance and guidelines are being met. So in order to collect credit cards, you have to be signed up to collect credit cards. So using a Telos Scribe, is that integrating now with 2.0? So it should be. I did see a demo that it's working with HelloNote 2.0. I know some clients are using it, so absolutely, you can use it. Okay, and then for the eligibility feature, the account shows authorization access restrictions. So if you have that, just let us know because we have to ensure that your NPI is properly enrolled. All right, so okay, so that looks like all for now. Again, you can keep sending questions. If we didn't get to it, we'll reach out to you directly to make sure that we answer your question. I do want to make sure that Kara gets to speak because I want to make sure that everyone knows about how the Business Builder program can benefit your business, along with clients that have used it and have successful results. So without further ado, I want to introduce Kara. So let's see here. Kara, are you there?
I'm here, but I think you have to push me
There she
through
is.
to the actual webinar.
Well, I'm going to make you the host.
Okay, we'll see if
So
that works.
let's see. Let's see. I made you the host. Did it work?
Okay, perfect.
There we go. Awesome. Thanks, Karen. Again, I just want to introduce Kara again. Kara's an awesome friend and mentor. So she does, she's very selfless when it comes to making sure that therapists can start their own business and grow their business. So she'll take any time out of her day. I know that. I don't know how, Kara, you have time for everyone, but you do. And how many therapists by now have been in the program?
We're over 300 that have been in our
Wow,
programs. So,
that's
um,
awesome.
so Steve and I met
That is
back in
awesome.
2018 when I started my practice. And I always tell him I was probably his worst nightmare when I started my practice, clueless. And then in 2019, Steve and I saw so many therapists struggling that we started the Therapy Business Builder program. So he's just as much part of the Therapy Business Builder program as I am. So he's been instrumental to what we've been able to do. And I know it's late, so I'm just going to do a really brief overview. I'm not going to go through much. We can send it out, Steve, in an email. The biggest thing we want to
Yes.
highlight is over the last 5 years, we've significantly changed our program, just like HelloNote is always working to improve. All of our therapists have had suggestions, so it's completely different than when we started. When we first started, we were really focused on helping therapists get going. And now it's been really fun to have businesses come in that are up and going, and they either want help to grow financially, or they want to add on staff, or they want to remove themselves from the business. So we do help current businesses that are already up and going. So that's been a big shift. What do you think, Steve? The last 2 years, maybe? Really, the last year we've really focused on it, but the last couple of years we've started having more of those therapists. So, even if you don't get help from us in our Therapy Business Builder program, there are programs out there that will help you and take a huge load off your plate, so you're not stuck in the daily grind doing everything yourself. So just kind of want to highlight some of the biggest things that Steve and I see for business owners, and just listening to all the questions on here almost gave me anxiety, because I know back in the day when I was first starting, what it's like to be by yourself and try to do this. A lot of times as business owners, we can hold ourselves back more than anything else. And what I've learned from going from me to over 20 people and over $1 million in revenue is I was my biggest barrier back for the first several years. So I didn't have any systems, poor organization. I was resistant to change and resistant to advice. We often think we know what's best when really we don't. Fear of letting go. And we hear this from therapists all the time. No one else can see their clients because they do it the best, and their clients only want to see them. Guarantee you, I said that 6 years ago. Unwilling to invest in business development tools, whether that's systems, additional staff, coaching, resistance to delegation. One of my business coaches a few years ago, and this is when I can go back to in the timeline of our home therapy solutions business growth, when we completely took off, is when one of my business coaches stressed that if anyone can do it, or if someone can do it as 80% as good as you need to delegate that. And immediately, like, things took over. And last week, well, 2 weeks ago now, in my home therapy solutions business, my staff took care of hiring a completely new person all by themselves. I had absolutely not one thing to do about it. I can be gone for weeks at a time, and I know it's working well, so you can get there, but you have to be willing to do that. And we work with several businesses that don't want to get to that stage. They want to stay at one person. So it does really depend on what you're doing. I say over-reliance on social media probably causes the most problems that we see, especially on the compliance side of things, when people are getting audited and having issues come on that side of things. Also, very poor financial management. No idea what their profit margins are, no idea, what they should be setting aside for taxes. Those are some of the biggest barriers we see. And I'm just going to kind of skip over some of the stuff that we do in our program, just to kind of show you what business owners that do invest in themselves, what can really help it happen, because this is the best part about our job, when we can look at the year or even a few months for some people on what they can do. And I don't know, just so proud of therapists. So this therapist came to us a year ago and has multiple therapists. Their goal for client visits was 460, and they're over 460 right now. But the problem was like the financial management, the lack of systems, it was just mere chaos. So Q1 revenue was 5,000. Q3 revenue is 34,000, and now Q4 revenue is projected to be 75,000. And we had to take multiple step backs over the course of the last year, because sometimes you have to go backwards and get some of your foundations fixed before you can go forward. But I had to run these numbers multiple times. I mean, 1,245% increase in revenue. So she 13 times the revenue for her business. And the most important thing is they're getting their financials under control and feeling better as a business owner. So everyone kind of has their own goals when they come in. But that was a pretty fun one to see. This is another therapist that in Q1, she had just getting started. And in fact, in March, she was ready to give up. She was ready to not continue with coaching, and we really sat down and had a discussion, and she's in a state that was hit by the hurricane, but she's also in a state that has a ton of Medicare Advantage plans, which can be really frustrating, as I'm sure a lot of you know. And she was actually thinking about shifting to pediatrics and not doing older adults. And but we came up with a game plan, and she just went full force, and like her business has grown 7 times in 3 quarters. And in the process, her and her husband are literally building their own home, and their community was completely devastated by the hurricane. But this is all from, creating systems. So many of us, I mean, I had no idea what a system was when I was in my business, and have learned through coaches over the years. But she's done this through just hard work, dedication, building systems, delegation, hiring the right staff as well. This is another therapist that she was hesitant of starting our program for a couple years. And she had built a very solid business by herself, but she was burnt out. She was doing everything. She managed her business. I mean, her whole business was in a journal or a book. She would write down everything. And so Q1, she was at 56,000 for her revenue. She's projected to be at 118,000, but even better than any of the financials is she now has time for her and her sons. And we were trying, the last time we were meeting, we were talking about, okay, what else can you give up for the admin to your virtual assistant that we got in place? And she's like, I don't know, I don't even have things to do sometimes. So even more important than the money was that she kind of regained control over her life again and has free time. Her mom told her how she could just see a life and day moment, or just complete change over the course of time, and so much less stress. Let's see. This therapist came in July and is just in our program a short amount of time. And, the person came in with, lack of finances, no clear, not verifying insurance, no bookkeeping, no idea what profit margins were, things like that. And moved offices during the course of July. And again, revenue growth increased, but more importantly, now has some systems in place, but also now has a bookkeeping system in place, understands their numbers, and has probably even more important, they were doing a lot of time on admin and now way less time on admin. So you guys can do it, but sometimes it takes an outside person to look at what's going on. But I will also tell you that we have plenty of therapists we work with that they're very resistant to change. They don't want to change. They don't want to take advice, and it takes a lot longer. So just be open to whoever you're working with, and because any coach you work with, whether it's our program or any of the other coaching programs out there, they're out there to help you improve and get there faster than like what many of us did when we were struggling doing on its own. This is a newer therapist that he's one that anything you tell him, he immediately implements and does. And in July, he had 42 visits and he started a part-time VA. He increased the VA to full-time in 5 weeks. By October, his visits grew to 109 a month. And he has fully automized his systems in place. But he's a great example of just implementing. Our last meeting, he was struggling with getting his notes done, which is a huge issue, right? So we created a solution for that, and he sent me a message. His notes are all caught up and the system is working. So if you guys are frustrated and things aren't working and you want to have more time for yourself, or you want to have more money in the bank, or you want to know what you're doing, we're here to help. Our program includes HelloNote. Again, Steve and I have worked together 6 years now. We do have a CRM system that we use and an automation guy, but it does take you guys wanting to change, willing to change, to make that happen as well. So, yeah, that's just a little review. But if you guys need help, reach out, or there might be other programs that can help you as well to reach these goals that these therapists are. And this has been really fun because Steve asked me to put together information for you guys tonight. So I just started plugging these in, but we're starting to do these reports for our therapists, because when you're in the grind of doing the business, running the business, you don't really look at what growth you've had from 1 month to the other. So now we're able to put these together so they can see all they've accomplished over the course of time.
Awesome. Thank you, Kara. I appreciate that. So yeah, as Kara said, I mean, there's so many opportunities, and whether you're just learning about this now, whether it's having somebody to help you focus on your business, or using an EMR system, you're just waiting for the right time. There's always an opportunity somewhere. So, and that's why we're here. We love to kind of be in the community, and we're always available. So if you want to reach out to me, my email is steve@hellonote.com. Please reach out if you have any questions. I'll be happy to answer. Even if you don't use HelloNote, I'm always speaking to clients. And if you're waiting for the right moment to use HelloNote as an EMR, we will be grateful to have you join us, because with you, this is how we learn. It's how we grow. And especially in the new year, I feel like there's a lot of people that are taking that, final decision to say, okay, now I'm going to make my move. So whether you're a first-time customer or you've been with us from the beginning, you're the reason we get to do what we love. So we appreciate it. Thank you, everyone, for attending. Thank you for our awesome team. Thank you, Kara, for putting this together and joining me here on this evening. So again, happy holidays to everyone, and we look for a very fruitful and amazing and innovative 2025. Thanks, everyone. And we're going to share the recording and like a summary to everyone who registered. So if you didn't get to listen live and you registered, please check your email. Hopefully by tomorrow you'll get a summary. So thank you, everyone. Have a good evening. Thanks, Kara.